Today I'm going to discuss about mini mental state examination. There is a different entity called as mental state examination, which is a part of psychiatry or psychological assessment, which is based on, interpretation of insight, judgment, thoughts, thought process, thought command, which we do in psychiatry as a part of psychiatrical assessment in patients. But today what I am going to discuss is mini mental state examination, which is a scoring system so called as Falstein's test, which is used to assess the cognitive function. So be very clear that MSE or mental state examination and MMSE or mini mental state examination both are two different entities. So what is this MMSE? It is done in CNS examination to assess the cognitive function of a patient, to assess whether the patient is having dementia or not, which is majorly based on 5 components. Number 1, orientation. Number 2, registration. Number 3, recall. Number 4, attention and calculation. And number 5 is language and intelligence. This can be remembered by mnemonic ORAL. Okay, ORRAL. So first coming into orientation. Remember, orientation has total of 10 points because the total scoring system is 30. Okay, here orientation has 10 points, which has 2 questions, each of 5 points, where we test the orientation of the patient to time and place. For example, what was today's date? Whether we are in May or March. Currently, where are you? Are you in the, ward, hospital, or are you at your home? All these questions. So orientation, 2 questions, 5 points each, total 10 points. Second comes registration. Maximum score 3 points. I am telling names of 3 objects to the patient. I am asking the patient to repeat the names of those 3 objects in the correct order. If the patient is able to say this in his first attempt in the correct order, give a maximum score of 3 or 2, then 1. So 3, 2, 1, maximum 3. First attempt, correct order, correct names. Then comes attention and calculation, where the score of maximum 5 is given. What I will do, I will ask the patient to subtract number 7 from 100. Then 100 minus 7, okay, the patient will be saying 93. Then again from 93, 7. Ask the patient to do that for 5 times and the maximum score of 5 is given for 5 attempts. Okay, 5 is given. Then coming into the fourth one, which is the recall. Actually, I have, in the registration part, I would be already told the name of 3 objects to the patient. In recall part, I am asking the patient to repeat or recall the names of the 3 objects that I have told him earlier. Okay, that is recall. If suppose the patient is able to recall the 3 names correctly, give a score of 3. So maximum 3 points. And the last part, language and intelligence, where there is a maximum of 9 points. Out of that, first 2 points is given if the patient is able to name the 2 objects correctly. For example, I am showing pen. What is it? The patient saying, okay, this is pen. Okay, then I am saying, okay, what is this? It is a sticky note. Or I am giving showing watch. What is it? The patient is saying watch. So 2 objects, if the patient is able to identify and name it correctly, 2 points. Then come the 1 point to correct repetition. Okay, the patient would have already told, no, this is pen, this is pencil. Ask the patient to repeat it correctly in the correct order, repetition, 1 point. Next, 3 points for a 3-stage comment. If the patient is able to obey a 3-stage comment, you are going to give 3 points. What do you mean by 3-stage comment? I am telling the patient, take this piece of paper, fold it into 2, place it on the floor. This is a 3-stage verbal comment. If the patient is able to do, 3 points. And next, 1 point for written comment. I am writing in a paper, close your eyes. I am showing that to the patient and the patient is closing his eyes, 1 point. Then next 1 point if the patient is able to write a meaningful sentence. And the last one, if the patient is able to copy down a polygon or pentagon, this is actually 1 point. And this is, so total of how many? 9 points. 1 point for the pentagon copy, 1 point for a meaningful sentence, 1 point for obeying a written comment, 3 points for obeying a verbal comment, 1 point for correct repetition, and 2 points for naming the objects properly. So totally 9 points, and totally a 30 score. So total 30 score is 30, that is the maximum score. Suppose if the patient score is between 22 to 30, I am saying that the patient is normal or the patient is have normal cognitive function. Suppose if the patient score is between 15 and 22, I can say the patient is having mild to moderate cognitive dysfunction or mild to moderate dementia. Suppose if the patient score is less than 15, or okay, I can say the patient is going to have, or some book says it is less than 21, but most of the books, standard book says it is less than 15. We can say that the patient is having severe cognitive impairment. So it is Folstein's test, maximum score 30, orientation 10 points, then registration part 3 points, recall parts 3 points, attention and calculation part 5 points, language and intelligence part 9 points, total of 30. Okay, and it is used to assess cognitive function in a patient. Don't confuse this with mental state examination we do in psychiatry, which is not at all a scoring system. So hope this video is helpful for you. Thank you.